So the question is, what causes persistent symptoms in Lyme disease? So there's lots of arguments over this. There's been studies done all over the world, not very good studies. So my hypothesis is that if you still have symptoms of Lyme disease after the standard treatment, there's three possibilities, and they're not mutually exclusive. There can be persistent infection, there can be ongoing immunological damage, and there can be inflammatory damage that's going on. Second off, sometimes it's not Lyme disease, sometimes there's other tick-borne infections, and we are just beginning to better understand the role of many other intracellular pathogens in causing chronic persistent infections, tick-borne infections including Bartonella, Anaplasma rickettsia, and Babesia, and also other intracellular organisms, Mycoplasma and Chlamydia pneumonia, are known to cause persistent inflammatory states and continue to persist. There continue to be persistent infection. So there's all these theories as to what's going on, but my observation is that in many of the cases there's chronic, persistent, untreated infections, and people do get better in many of those situations by longer courses of antibiotics. There have been studies done which showed people benefit from longer courses of treatment, but these studies have been poorly done, and people argue that these studies are of benefit, and in the other breath, the opposing groups argue that these studies are not of benefit. So this really is a challenge. What's going on when people don't get better on treatment or fail on treatment? They could be reinfected. They may not be taking their medication. And then obviously there are other conditions that mimic Lyme. So they could have other conditions. They could have ongoing second infections. They could have anemia, hypothyroidism, B12 deficiency, POTS, and maybe they just do have fibromyalgia. But the important thing is the history, as far as I'm concerned, and previously well people who suddenly get this unexplained illness, and I have rheumatologists who are diagnosing people with ankylosing spondylitis, although all of the blood tests are normal, but they also have palpitations, they have bladder problems, they have eczema exhaustion, they have migratory arthritis, but they've got ankylosing spondylitis. If you look at the textbooks on ankylosing spondylitis, patients do not have all these other multi-system diseases. So people are being put into certain baskets very often, depending upon which specialist they go to see first. So there are statistics around the world on, how common Lyme is. The Centers for Disease Control in America is now estimating 300,000 new cases of Lyme every year in America, and that 10 to 20% of these patients continue to have persistent or recurrent symptoms after 2 to 4 weeks of antibiotic treatment. So a study by DeLong et al. Then have calculated up to 2 million cases in the United States by this year will have chronic persistent Lyme disease. The challenge then is what to do with these patients. PTLDs patients, which is post-treatment Lyme disease, a term used by somebody at Johns Hopkins called ALCUT, could be, P could stand for post-treatment, but post-treatment doesn't mean it's post-infectious. So this should be partially treated infection, this should be persistent treated infection, or it can be a combination of infection, inflammation, and autoimmunity. And patients with PTLDS in the studies by ALCUT show fatigue, musculoskeletal pain, sleep disturbance, and depression, which are both clinically relevant and statistically significant. And in some studies that have been done, when patients were treated with antibiotics with this condition, there were clinical improvement in these symptoms. However, we have no gold standard for diagnosis. We depend upon antibody immunological assays that are imperfect. The challenge will be in the future to have a gold standard that is a PCR, that is an antigen-based test, then we can have better studies and better understanding of, patients with PTLDS, which component they have, which part are persistent infection, which part are post-infection. Until we have better diagnostics, the best way we have of assessing that is treating people and see if they respond to the antibiotics.